afternoon, everyone. I'm Dr. P. GEETHIKA. My topic is a clinical study on ocular manifestations of COVID-19 associated mucormycosis in GGH Kadapa. The aim of our study is to report the ocular manifestations of patients with COVID-19 associated mucormycosis admitted in GGH Kadapa. Background: this is a retrospective observational study where the records of patients who were admitted during second wave of COVID were studied and data was analyzed. Mucormycosis is caused by the residence of sporangiospores in paranasal sinuses, their germination and further penetration into orbits, cavernous sinus and the brain. Uncontrolled diabetes mellitus is the most common risk factor identified in patients with mucormycosis in COVID-19. There was sudden increase in the surge of mucormycosis cases during second wave of COVID. Till date, there are few studies reporting the ocular manifestations of CAM. So, IJV proposed a recent staging of rhino-orbital mucormycosis by Santosh Hanavar. In stage 1, there is involvement of nasal mucosa. Stage 2, involvement of paranasal sinuses. Stage 3, involvement of orbit. In stage 3A, nasolacrimal duct medial orbit is involved. Vision is unaffected. Stage 3B, diffuse orbit involvement. Vision is unaffected. Stage 3C, retinal vessels involvement of superior inferior orbital fissure. Orbital apex is involved. There is vision loss. Stage 3D, bilateral orbital involvement. In stage 4, involvement of CNS. Observations: we have reported several manifestations of CAM, including ocular pain, abnormalities of ocular motility, proptosis, ptosis, eyelid edema, subconjunctival hemorrhages, corneal edema, anterior segment inflammation, raised IOP, and abnormalities of pupillary reaction. Ophthalmic artery and central retinal artery occlusion were the most common underlying etiology behind posterior segment disorders and loss of vision. We have reported with 56% of patients are presented with no perception of light, 15% with orbital cellulitis with proptosis, 14% with ophthalmoplasia, 14% with orbital cellulitis with extracorneal involvement, and 1% with bilateral orbital cellulitis with cavernous sinus thrombosis. Results: out of 100 patients admitted with CAM, 46 patients had ocular manifestations and 96% with CAM had diabetes. In the present study, the mean age of patients is 50 years and age range between 20 to 80 years. In our study, 15% are in stage 3A, 39% are in stage 3B, 43% are in stage 3C, 3% are in stage 3D. Conclusion: knowledge of various presenting anterior and posterior segment manifestations of the disease as described in the present study will therefore guide clinicians to recognize the disease early and make every effort to prevent complications. Thank you.